Information from RFSU about birth control. In order to make your own decision about if and when you want to have children, you can use birth control. There are a number of different methods of birth control. Some of the most common are IUDs, or intrauterine device, birth control implants, the pill, condoms, and morning-after pills. An IUD is inserted into the uterus. There are two kinds, copper IUD and hormonal IUD. A copper IUD is a form of birth control that can also be used as an emergency form of pregnancy prevention. In the latter case, it should be inserted within 5 days after you've had unprotected sex. It can then stay in place as a continuing form of birth control for up to 5 years. If you use a copper IUD, you will still get your period, but you may bleed more than usual. If you use a hormonal IUD, your period will often disappear after a while, or it will become more irregular. Both types of IUDs provide protection against pregnancy as long as they stay in place inside you. The protection lasts for no more than 5 years, however, and then the IUD must be replaced. A birth control implant is a small, soft plastic rod that is inserted under the skin. It often makes your period disappear or become irregular. A birth control implant provides protection against pregnancy for 3 years. Both the birth control implant and the IUD are inserted and removed by a midwife or doctor. The pill is a tablet that you take every day. With some birth control pills, you will still have regular bleeding, similar to your period. With other birth control pills, you will not have any bleeding at all. If you forget to take your pill for 1 or more days, you could become pregnant. In that case, you'll need to use a condom for 1 week in order to have good protection. Morning after pills can be used if you've had unprotected sex for any reason. These pills can prevent pregnancy, but are not dependable enough to use as your only birth control method. There are 2 kinds of morning after pills, one that you have to take no later than 3 days after sex, and one that you have to take within 5 days. The morning after pill is available at the pharmacy or at a youth or maternity clinic. The morning after pill will also work if you've forgotten to take a birth control pill. A condom is the only birth control method that protects against both unwanted pregnancy and STDs. The condom is slipped over the penis and must be worn the entire time you are having sex. All birth control methods have their advantages and disadvantages. There are also more methods than the ones we've told you about in this film. Your midwife or doctor can give you good advice and tips.